Good morning, afternoon, or evening. A warm welcome to this Common Operational Datasets, also called CODs or CODs, for emergency webinar, which aim to improve your knowledge about those critical resources before an emergency or a disaster strikes. You will learn how to access critical documentation, some methodology, as well as aspects to consider when advocating for common operational datasets. This webinar is open to the entire information management community and is scheduled to last an hour and a half. Today, we are pleased to receive our esteemed colleague, Tom Aisonwaite, from the Field Information Services team. Tom is a Geographic Information Officer with more than 10 years of experience working with common operational datasets. As you can see on the screen, the webinar will be divided into 5 parts, and the final part of the session is, as usual, dedicated to your questions. If you're watching the recording, please feel free to reach out to the FIS team by email. Your email object should be as written on the screen, inquiries in bracket, follow-up CODs for emergency webinar. You are also provided with key links of the session under the item More About CODs. Feel free to like and comment or share the video with your relevant colleague and to subscribe to the channel to get notified when a new webinar is out. Without further delay, we will now begin with the presentation of our colleague Tom, whom we are very honored to have with us today.
Thank you for the introduction, Manon. Welcome to everybody who's joined in. So let us begin. I framed this as 6-section presentation. This is an introduction to a scenario.
Assalamu alaikum, OCHA IMOs. This is Ahmad Siraj, OCHA IMO for Regional Office of Caucasus and Central Asia. Please just call me Siraj. I'm sending you this from OCHA Roka headquarters on Saturday evening. The earthquake was last night and we felt it here in Almaty, 700 kilometers away, so we know it was a big one. I'm heading to the airport now to fly to Islamabad. We're definitely going to need IM support here. I already know we need to set up a meeting schedule and the IMWG, but I'm sure there are many other tasks that I haven't even thought of yet. I'm looking forward to your support and advice and help. Bye for now.
Okay, here's the summary. That information management officer you saw is someone very dear and close to me, and he's reporting about having to deploy to a country called Simland, where there was an earthquake. He's going to go there. Other IMOs will come in, deploying through various mechanisms such as UNDAC, through standby partnerships, or as members of NGOs and so on. Of course, the key responders are local responders, and I hope that he will coordinate with local NGOs and local people and even beneficiaries if possible. He knows he has to do 2 IM products. He mentioned a meeting schedule and to form the information management working group, but he doesn't know what else will be required. Now, Manon, please let's go to your next poll. One person's immediately said maps, assessment reports. I think we're getting repetition of maps.
Pin and targets.
Very good. Flash email. Contact lists, information note, data collection, collection templates, assessment report. Now, there may be people that are not very familiar with an emergency response. You're welcome, if that's you, to guess what you think those who rush to the scene of the emergency may need to be preparing. Or you might imagine yourself as asking, what do you expect to see as you sit doing some other role in the humanitarian world? What information do you expect to have come out of the emergency?
Infrastructure damages.
Excellent.
Assessment report, data collection, maps. The bigger one is flash email, information note, collection template, contact list, pin and target, and infrastructure damages. Data collection templates. And number of casualties, elevated model, population mobility.
There's mapping and maps. Maps need geographic boundaries. Then there was some in the word cloud damage maps. That means it's an example of a thematic map. A reference map is just showing boundaries and perhaps place names. Other maps may just show locational information. But that was an example of a reference map, which is a map showing some particular data. These are very powerful, very important, and very common. And so they are a type of map that needs boundaries. Both through what we see on the screen, what people entered by chatting, gives us a very broad selection of humanitarian information management products. And I will ask which of these that we've just enunciated require maps or administrative boundaries. The answer is almost all. It started with a bit of a trick question. I mentioned I'd mentioned meeting schedule and forming the information management working group. Those are almost the two tasks that do not require common operational data sets. Virtually everything else we've discussed does require common operational data sets. Okay, I'll move on. Which of those products require population statistics? I think we saw PIN, people in need, definitely in infographics. It's very likely that an infographic in the context of an emergency is going to be showing some information like the people in need, the assessment of the human extent of an emergency. By the way, location of emergency goes back to mapping. But our snapshot, I'm looking at the word cloud, our damage assessment, infographics, disaster map, maybe showing human extent. All these are requiring a baseline statistic or population statistics. If you say that half the people are affected, you don't know how many people are affected until you know how many people live there. That's the concept. And that's why I'm showing, trying to demonstrate the importance of map boundary data that can be used to make maps, and population statistics. In this presentation, we're going to concentrate on making a map of affected population. So I'm going to continue the scenario, and then we'll see the background of the necessary data. This is Simland. It's a country in Central Asia. You can recognize some of the neighboring countries that you see on the map. And unfortunately, there was a major earthquake at the epicenter shown. I think it happened last night. Here we supply on the map Simland sub-districts. It's administrative level 3. In Simland, there are provinces, then districts, and then sub-districts. These are the sub-districts. They all have a name, of course. And these 3, we are immediately told, have been affected by the earthquake. But how many people have been affected? Following is a framework to try to answer that question. I've replaced now the names of the sub-districts with P codes. We'll talk more about P codes, but they are unique alphanumeric identifiers for places. Someone has made an assumption that half the population in the affected sub-districts are actually affected people. So they come up with this total over 200,000. Let's see what we think of this methodology. But given the data that is determined, we can make these proportional circles. There are apparently more people affected in the more southerly sub-district than in the sub-district that had the epicenter. What are some possible weaknesses of this approach? No SAD means no sex and age data disaggregation. Fabulous. Data. The data is certainly questionable. Are there any more remarks about deficiencies or something inappropriate or absent in the methodology that was quickly applied? Yes, it was done very quickly, maybe not with enough thought. Very, very good and important point. Lack of accuracy, very much true. Methodology, I think the methodology was hardly described and was certainly not robust. I don't think we could defend this. Cannot validate data. Splendid point. That is a valid point. We cannot validate the data. Highly assumptive, yes. Someone in the scenario perhaps someone highly paid, said, we will do it this way. Quickly, it was imposed with an arbitrary remote assumption, I think. Okay, thank you. We're generally agreeing that the methodology was not well thought out, probably not effective. It's using approximation that were just popped up, specifically for the numerics of people involved. It's not addressing the need for sex and age disaggregation. Not very valid at all. Now I'll go, if we look to my screen, here are thoughts I had. What on earth was the rationale behind the 50% assumption? There was a very arbitrary set of subdistricts chosen. We don't have any knowledge or data about the actual distribution, the pattern of the shake map, the seismic distribution that we would in reality get from the United States Geological Survey. We don't know anything about the vulnerability. Some people live in homes that are much more susceptible to damage from a given shaking than others are. We don't even define what is affected. Does it mean that they were caused to have some worries, or does it mean that their livelihoods have been destroyed? What is the scaling of this affected word? And is it allowing for the effects of aftershocks, which are like a double tap? A, they can hit when you're already more vulnerable, or B, they just add to damage. This was a set of possible weaknesses, overlapping, I think, with the weaknesses mentioned in the poll. So thanks for all contributions. Let's pretend we are happy with that approach, even though we shouldn't be. What were the types of data? There were administrative boundaries and there were population statistics. These were linked together via P codes, which we'll talk more about. For population statistics, we need to use them to work through this onion model of different numerics for a response. Total population is the total. You can't have more people affected than live there. And yet sometimes when we've had poor data, not good use of common operational data sets, there have been claims that an affected population is greater than the actual population. As a response continues over weeks, days, or months, we might reach down to count the number of people covered, but that's as things progress. These are the types of data. How can they provide it? This was my screen when I made one of the maps. So that's a data set that was needed for making this map. And I'm pointing to the fact that we're adding a layer called admin 3. I got this layer, geographic boundary layer, online from Geoservices in America called the agency's ITO. Here is the population statistics product. It's a spreadsheet of the Simland population statistics. The rows are different subdistricts. Notice at the bottom there are different tabs. They are for the different administrative levels. In fact, the spreadsheet has a tab for admin 0, the whole country. Admin 1, it's the provinces. Admin 2 is the districts. Admin 3 is the subdistricts. In this case, for Simland, we have admin 3, so we cover the country. And then with fewer and fewer records, we might see then the provinces, the districts. Here is the sub-districts, and one of them has been highlighted. There is at least one common operational data set where we get to admin level 4, and the relevance of administrative levels varies from country to country. The columns are mainly, especially the green ones, different sex and age categories. This is proper sex and age data disaggregation. For each age group, in this case, the age groups are children 0 to 14, young adults 15 to 24, older adults 55 to 64, and those seniors who are over those ages. For every single age category, proper SAD, sex and age data disaggregation, has information for male and female. This is what we try to achieve for all population statistics data sets. So now we're getting to the one or two most important slides of this presentation. These are the key aspects of CODS. they must be agreed by all. All means relevant stakeholders. That's why they're called common. The stakeholders must say that, yes, indeed, this particular data set, that would be boundaries or population statistics, is the best available and it's the one that should be used. Next, they are in standardized familiar formats. That means they can be used in a way you expect to be able to use them, in the way you can become able to use them, and they're not provided in some off-the-wall different way. Formats. That means shapefiles, geodatabases. We're not going to go deeply into live services, but in one way that most geographic information systems can absorb, or provided in alternate ways, such as EMF files that could be used for the very powerful PowerPoint mapping technique. But they are packaged in a way that can be easily used by people making maps. Even the spreadsheets have standardized headers for the age and sex categories. These must be available to all. It's an important principle that they should be openly available. Used by all isn't just trivial. It means that common operation datasets will be accepted not only by these first stakeholders that help develop them, but are used and accepted by all participants in information management, including from NGOs, including from local NGOs who may not have had a role in the creation, but now we want CODs to be adopted by everybody so that we're all working on the same data page. The relevance of remarking that they should be used by all is that all people participating in a humanitarian response or preparedness activities should commit to using the standard agreed upon COD. And you even all have a role and a responsibility for advocating to others, to the community, about CODs. So for formats in particular, for admin boundaries, there are geographic information system shapefiles or geodatabases or geoservices. We also offer EMF files that can be used for PowerPoint, all different output products of a geographic boundary layer, which is maintained. Spreadsheets are the format for population statistics. P-codes combine them. Available to all, this is facilitated by the wonderful platform HDX. Used by all means in every aspect of coordination, of clusters, intercollection, 3Ws, and so on. Ideally, not always in practice, CODs will be used. And finally, everybody ought to be encouraging the use of CODs, putting it into their own documentation, their own toolboxes, their own standard operating procedures, etc. That's actually what in one page, what I hope we take away from today. Now, this is a slide from some of our other documentation, OCHA documentation, about common operational data sets. I'm cheerfully presenting it, but don't want to emphasize all of this. Lower left, we see the humanitarian profile is a concept where after an onset of an emergency, and after we've put numbers into the populations, taken the population statistics, formulated a way of calculating people in need, then the number targeted, and so on, these numbers may go into a humanitarian profile or humanitarian needs overview that's developed after a crisis. I'm not going to emphasize this much further today. The main preparedness common operational data sets are the admin boundaries and pop stats. However, there's a whole other set that can be given the rubber stamp or the sticker that says common operational data set. These can be country specific data sets, such as we show here evacuation centers or rivers. There are a broad set of possible themes for country-specific common operational data sets, and they depend on the type of country and the location. Some may have susceptibility to landslides, and that might be completely irrelevant in another case. The earthquake location may become a shapefile showing the shake, that is the seismic influence area or something like this. This may become available. But for this presentation, we're concentrating on the lower left, admin boundaries and pop stats. Now, I'm going to discuss how CODs actually help with humanitarian information management. And here I want to warn you that I'm not going to go deeply very much further about discussing the live geosurfaces. As a simplified introduction, there are other very, very important aspects of CODs, including availability of boundaries. Now, every country is available not only by downloading shapefiles or geodatabases or EMF files from HDX, but also through live services provided by our partner ITOS, which is part of University of Georgia in USA. They are linked with us and they do the quality control, the configuration to standard schema, and launching of live services that let you pull the most recent COD AB for any country into your GIS in your computer almost instantly, but always with the newest data. With apologies to our friends at ITOS, I'm not going more deeply into this aspect now. Also, I'm not discussing today one of the related products, the EdgeMat admin boundaries, because we want to provide COD ABs as the best available in each country. They may not disagree where they have a common border. Eritrea and Ethiopia CODs right now show a different edge for that boundary. Boundary discrepancies between COD AB products can be due to disputes or due to whether or not something's included. For a while, the Pakistan COD AB did not include any of Kashmir. Even Pakistan claimed Kashmir, so that was just an exclusion. They may simply disagree because of surveying quality. Or finally, if you digitize along a river that is known to be a boundary, your points that you mark with your digitizing with your mouse may be different from mine, even though they're of the same quality from the same source system, the same source document. So admin boundary COD AB products don't always match exactly at the boundaries. We have edge match versions that are adapted with a theoretical degradation of quality. Edge match is ones that intentionally distort the country boundaries to fit together to each other. This can improve cartography and can improve or enable analysis of cross-border linkages between subnational units. So, for instance, it could show us and could let us technically analyze which sous-prefecture in Chad border which sous-prefecture in Central African Republic. But I'm not going much further about these today. So if we have a slightly revamped scenario here, we want to send you out. We have 26 people. We're going to randomly select you and send you out to 26 villages in southeastern Simland. And we want to report on the impacts. And we need to, of course, where you are doing this. Now, you may ask people, they've been displaced. So when you conduct the interview, you may not be in the place where they live and where they've been affected. So you might say, which subdistrict were you living in during the earthquake? And some people in my scenario may not understand what you mean by subdistrict. They're more familiar with the health zones they live in because they structure their geographic lives according to access to health facilities. Health zone being a catchment area, for instance, for a hospital. They may refer to traditional clan boundaries. In some parts, I'm thinking in some parts of Horn of Africa, but I'm not an expert. People are identifying more by clan than by a government imposed boundary. They may think about subdistricts that were in place before some political changes or administrative changes. There could be all sorts of reasons why the best available common operational data set boundaries are not familiar to local people. But we want to have one system, and we want it to be the admin boundary set that has been agreed upon. And so we need to have a standard tool. It is the COD AB administrative boundaries. We need to think about the fact that different people may work in different languages. There may be different spellings for different spelling for one commonly understood name. The easiest thing that can simplify having an interoperable, compatible set of data responses is P codes or place codes. It's best then to provide a list of what you expect. Then you can make lookup lists to other names, or we can work from coordinates captured by survey devices like Kobo on your phone. They track the coordinates. We have tools to let the coordinates show you which common operational dataset feature is involved. I don't mean to disrespect people's concentration on health zones, for instance, but we need one common operational platform, and that's it. On this map, we see again our version or our understanding of subdistrict names. They may be ambiguous, they may be unfamiliar, they may not be in your alphabet, but now we have added the P codes, the Simland P codes. Each code is unique not only in Simland, but it's actually, because it has the country prefix, it's unique throughout the world. Each code is hierarchical, and these are subdistricts. If we look at the one nearest the epicenter, SX020303, in fact, the P code for the district would be SX0203. It is the parent and it has child P codes. The P code for the province would be SX02. We can extend this hierarchical viewing to consider that the P code for the country is SX, still unique worldwide. This is the page from the Simland Gazetteer, the reference. In fact, in a way, the Gazetteer, which is a table of place names and place codes, is a bit like the population statistics tables. The population statistics are presented in the same way with a record per administrative feature. I've highlighted here one subdistrict with the epicenter, and we can see its name. We see the name of the parent district and its P code. We see the name of the parent province and so on. And our friends at ITOS, the agency that does all the hard work, have even told us the area in square kilometers, 10,000 square kilometers. This is useful for direct analysis, useful for density mapping, where we might want to talk about the density or people of affected people per square kilometer, which is better for comparing. P codes again have four sort of thematic applications. We've already seen how P codes link the COD AB admin boundaries to the COD PS population statistics. P codes also link these CODs to an independent data set. Maybe it is your survey of or your assessment of needs in villages. If you use the P codes in your assessment, then it can be made compatible with the AB or the PS. Then we can extend this view and see that P codes therefore can link one independent dataset to another, not even involving CODs. Apart from establishing these linkages, the gazetteer or P codes list can donate its structure to the creation of new independent assessments, reports, 3W systems, technical systems, any other thing that has a geographic framework that you might use and develop can and should incorporate the gazetteer, so it will become P code compatible. At this stage, we sometimes get people saying, where do you get the CODs? Not where's the beef, where's the CODs? We will get to that. How are they developed? Types of CODs we've been emphasizing, there are others. COD population statistics are mainly now developed by UNFPA. Some of the oldest ones, the legacy ones from a few countries, have not yet been updated by UNFPA. That's the United Nations Population Fund, I think. And so some old ones don't have their contributor name, but the new ones do. And UNFPA COD PS datasets have various standards and quality assurances. They always have SAD data, sex and age data disaggregation. They're always linked at the best possible level, administrative level, to the COD AB, boundaries. Basically, population statistics, common operational data sets are developed, prioritized, developed, projected, or updated by UNFPA. But the stakeholders in a country or a region or an FIS section of OCHA can influence UNFPA. We can say, please, could you develop for Samoa? This is in progress. We're just waiting to understand the P codes. But UNFPA now does the hard work. They have the expertise to do this for two or three reasons. They sometimes can get unpublished data from national statistics organizations. They have the right or the power to do this because they are giving so much money to fund the the national statistics offices. They also have the demographic capability and expertise for projecting. Projecting means if we have data from a census, imagine it was held in 2010, some are still older than that. UNFPA has the scientific demographic skills to make projections to forward years so that for every common operational dataset population statistics, we can declare the reference year. Some of them may have a reference year, meaning the data were the best available estimates for 2023 or 2021, or ideally 2024. For COD ABs, the main, and I hope no one in the audience who is working in a country office or a regional office, I hope you're not thinking to yourselves, oh yeah, Tom believes this is to be the case. It's not really true. Let's see what happens. I want to tell everybody that CODs are mainly developed by the information management working groups, those stakeholders that can contribute to the selection of data. They can direct the improvement of data. They may approve the selection of an existing P code system. All these things normally come from the government, but OCHA is responsible for getting consensus from all stakeholders who know what is relevant, they know the context, they should know what is needed, and they ought to be telling OCHA, and OCHA should be listening to what leads to the best available COD AB. Okay, where do we find CODs? Well, it's not as simple as this. This was from a meeting we had in 2016, and we have a scenario where the Ministry of Data handed over all geographic data cheerfully to the OCHA representative who's wearing a false mustache, and the COD was complete. It's not that easy in reality. We have to go through many processes of manipulation, cleaning. I can say in most, literally more than half of the cases, when the government hands over geographic boundaries, they have technical problems, topology problems, completeness, incompleteness, logical discrepancies, and it takes a lot of work. Now we're going to hear a song about the process. This song is written as advice to IMOs in regional offices or country offices who are actually building and developing CODs. It mentions the term of endorsement, which is something we down used to be that we had to get IMWG or resident representative to sign documents saying they approve of these CODs. Now it's more of a system of trust. Nonetheless, let's listen to the famous COD song.
There's nothing common about the CODs. When it comes to data, they're the ABCs that allow humanitarian agencies to manage operations successfully. Without them in the next sudden onset emergency, you'll still need to share them and you'll see the urgency. So it's better to have those data already prepared and not to start the emergency scared and impaired. New policy guidance makes them country specific. There's technical guidance so the data's terrific. Plan, collect, process, endorse, and communicate. Then an annual version to keep them all up to date. There's nothing common about the CODs. When it comes to data, they're the ABCs that allow humanitarian agencies successfully. Ideally, the government will be your main source. The IM network and RCHC will endorse. Then it's up to OCHA and clusters to enforce, and all implementing partners to use them as a resource. To prepare effectively in a high-risk nation, you need admin boundaries and baseline population. For current operation, there's a third core data set, humanitarian caseloads to measure how those needs are met. There's nothing common about the CODs. When it comes to data, they're the ABCs that allow humanitarian agencies to manage operations successfully. With core CODs, you can rapidly estimate the impact of earthquakes or typhoons that decimate, and give you rough figures of people affected to ensure that no one who's in need is neglected. Protracted emergencies need CODs in place, country-specific ones based on the risks you face, so clusters and sectors can effectively coordinate, assess, plan, resource, implement it, evaluate. If the quality of your CODs make you nervous, or you'd like to share them out as a web feature service, our friends at ITOS can give you advice and turn your CODs into something quite nice. So when you see your head of office, the first thing to mention is we need to give our CODs some love and attention, because once they're accurate and the HCs endorsed them, then everything you do will be similarly awesome. There's nothing common about the CODs. When it comes to data, they're the ABCs that allow humanitarian agencies to manage operations successfully.
So you can play it over in your mind until you won't be able to get it out of your mind. I promise you. Now a word about CODs and OCHA per se. I often hear people mention something called the OCHA CODs and also the OCHA P codes. I think OCHA understands why this happens, but we don't encourage it, and we don't want you to think of these as OCHA aspects. OCHA doesn't invent CODs. OCHA does coordinate the research, the improvement, and agreement that comes to make the best available CODs. But we believe that CODs exist only because of the collaboration and contributions of all stakeholders and reaching consensus. We accept that OCHA can be a burden on stakeholders. This is another information management officer who I know very well. The picture was taken in Pakistan during floods in 2010, and it was a sincere, and this person was working for IOM, but this was a sincere reaction to the burden of demands from OCHA. Nowadays, we try to reduce that load. So here is the answer to the main shopping portal for common operation datasets. Humanitarian Data Exchange, or HDX. The URL is humdata.org. This is the Amazon or the eBay for common operational datasets and all humanitarian data. Here is the location map you can see when you open HDX. The pink countries are countries or locations that have HRP, humanitarian response programs. But there are HDX data for almost everywhere in the world. Here's a link of the places. They don't use the word country, and we try not to use the word country because HDX splits the world into concepts called locations. We can see here Jersey. Jersey is part of the United Kingdom. We can see here, it's off the screen, but they have Greenland. Greenland is part of Denmark. More relevant to the common operational data sets is here we see Aruba. It's a lovely little island in the Caribbean that sometimes gets swept by cyclones. It's part of the Kingdom of Netherlands. Similarly, there's Saint Martin and Saint Martin. So locations is actually the geographic team word for the first granular level of common operational data sets. I highlight Namibia. Here is the HDX page for the Namibia subnational admin boundaries. It means the COD AB for Namibia. In HDX, the concept is a data set containing multiple resources. So there is one data set that is the COD AB. The resources are here the gazetteer spreadsheet, and shape files, zip file, EMF files for PowerPoint mapping. And we don't always do this, but you can see links for the geo services. It is the population statistics. It's the COD PS. It's also headed by the tabular data or the gazetteer. So the gazetteer has the P codes, and that links everything together. But this data set contains other resources, which are the general spreadsheet for population statistics, and then there are 3 CSV files. That's one for each table for each admin level. The other place that you can use as a starting point for knowing about CODs is the OCHA COD portal. It has 4 pages. This first page has this table. The rows are the locations. It says country name. It should probably say location name. And then the columns are links or attributes of the different data sets. You can see that for Russian Federation, we don't have population statistics. For Saudi Arabia, we don't have population statistics. So the set of COD ABs and the set of COD PSs is not identical. Page 2 of the portal shows various maps. You can zoom in and filter and look at different aspects. You may see here quality level. CODs are described as being of enhanced level or standard level. The enhanced level, for instance, for the ABs, have had all the topology checks and a long set of quality checks, which takes the specifications is, I think, 50 pages. ITOS does that and have done that for a growing number of the CODs. On this quality map, I'm looking at the one to the left, one down, the green one. There are blank countries. These have no COD. We'll discuss which do and don't. This hard to read page is one of our introductory texts to CODs. There's a dream that as CODs have a public face on HDX will provide user guidance and sharper versions of videos like this, and so on and so forth. This is coming in the future. We trust. The last page of the portal has statistics like this. Here we can see admin boundaries. 100 have reached the full verification stage. That means the work of quality control checks, standardization to a schema, by our friends at ITOS, and the other 64 are not. If you add 164 together, you get 164, which is less than the number of countries in the world. It's less than the number of UN nations in the world because we don't go everywhere. Here are some products that use CODs. This was from a week ago, I think it's a week ago today. Colombia, their map background, some of the geographic data comes from operational datasets. And this is talking about affected people, and there are data that derive from the COD PS. Here's another product for Angola. I chose this because it's not an OCHA product and it's not a UN product. It's from IFRC, and IFRC are definitely in our wonderful family of stakeholders for common operational data sets. And they don't have to be a stakeholder for developing them. CODs are available in almost every case for every user in the world who can connect and chooses to use them. That is the main part of my introduction for beginners or for the people we've had sign in for common operational data sets. But I want to end with how you can improve the worldwide community of common operational data sets, users and contributors. I'm reminded of a famous president saying, don't ask what you can do for your country, what can you do for your country? What can you do for the COD community? You may find, you see, that you come across independent data that uses place names that don't fit. Or you might find data, this is an example we saw yesterday, where someone includes statistics for Nigeria, and another person includes statistics for Maiduguri, which is in northeast Nigeria. So these are overlapping, that's hard to reconcile. You may get data places with valid but unknown spelling, etc. You might find maps that don't fit the best available common boundaries. Someone may have had they, in their mind, a good reason for using a different map, but I don't think there are very many very good reasons for using a different map when we should be using best available. They may be using their own population statistics. This can be disastrous and should be avoided. Here is this final steps that I hope IMOs will consider doing to enhance, broaden, and cement the adoption of CODs throughout information management so that we can avoid cases of suddenly receiving, for instance, a data set that tells us there were blankets distributed A in this province, but B in this town, and C another number from this health zone, and another number distributed in this overlapping district, etc., etc. For compatible, interoperable data, we should be using common operational data sets. So what could you do to help as we end this? Please mention that you're using CODs in all your product documentation. It only takes a few words or half of a sentence. This would reinforce the commonality, the fact that they are the standard. Please encourage NGOs and partners to use CODs when you're in coordination meetings or discussing a product or something like this. If appropriate, please participate in the annual IMWG COD verification and update process. I'm going to touch on that. Now, every year, we actually ask OCHA to lead a process of verifying current CODs. Current CODs may need redevelopment and improvement because the actual boundaries have changed. They may need improvement because they had errors. They may need improvement because a better source has become available. An example of this is how now we're preparing Chad with administrative level 3, when last year, or the current existing COD for Chad only had admin 2. Or they may determine on this 12-month basis that that a COD doesn't need verification, but this verification process is annual, and we ask everyone to participate in that. Finally, we would really encourage all agencies and entities to mainstream CODs in your own training, your own standard operating procedures, and your own toolboxes. With this, I thank you and hand over to, I think, Manon to lead us in any questions and answers. Over.
Thank you, Tom, for the very informative presentation. So yes, we will now move on to the Q&A section of this meeting. If you have any question, if you want to share any experience or challenges that you faced, please feel free to either raise your hand or to type directly your question in the chat.
I'll ship in that I noticed from a comment about early on a question about the presentation, and that the assumptions in our scenario didn't include sex and age data disaggregation. So again, sad, sex and age data disaggregation absolutely essential for our work, because vulnerability doesn't hit everybody equally, and in some cases there may be young males who are more vulnerable to army conscription, or in other cases elderly females, etc., etc. You can't always tell. Sex and age data disaggregation is not only necessary to do our work well, it's actually necessary to do our work in an improved manner. Population statistics enable this, and the concept should be extended to surveys and data gathering.
We have one contribution in the chat, which says, one pragmatic way to advocate more for the usage of CODs by national agencies and government is to systematically include a sensitization session on CODs in the capacity building missions or contingency planning development missions conducted by OCHA regional offices for countries.
Splendid. That gets a gold sticker, yes. Sensitization session in capacity building missions or contingency. I absolutely agree, absolutely love this idea.
We have a hand raise. The floor is yours.
Yeah, I mean, I don't think we have any problems with the CODs. Actually, XDX coming online was probably the best thing that an IM, officer or anyone can get. Because I think back in probably 2010, when I was attending to Haiti, A lot of that we didn't have. We would just go office to office, just trying to get these. And I think just to share an experience, most of the time it's not the problem of the codes or the standardization being available. It's just in the first few weeks, I think people are just using what they have available, and it's just the amount of data that you as an IMO has to clean until it normalizes and people, standardization kicks in. And as standardization kicks in, you probably find these issues like Tom mentioned about, different boundaries being set up or things like that. So if you don't have someone who's off from that area, who's giving you that context, then, you could go off in a different path. But, it takes always a bit of time to normalize and make sure everyone's reporting the same. So thank you.
Thank you for that. It's a wonderful recollection of the process we go through at the beginning. I haven't emphasized enough, I think, the fact about COD preparation in advance. Of course, whenever there's a new emergency, my boss, Janet, writes to me and says, or phones me and said, Tom, please confirm these CODs are okay, whether they are or aren't, and talk about the limitations. But this is already depending on the fact that we're trying to prepare CODs in advance. That's why we have not just CODs for 27 country offices where there is an ongoing response or ongoing vulnerability, but about 164 others, or a total of 164, that are there in case, particularly for, I would say, particularly typhoons spread themselves around the world and jump where we can't predict very clearly. And so that's why we have CODs for a lot of little islands that may not have had a typhoon for 3 years, but we're ready for the next one. So part of my reaction to your remark about the community growing into CODs at the beginning is that they can't even do that if we haven't had a good preparedness program. Thank you for mentioning it. Another is the communication about CODs as the emergency unfolds. So let's say the cooperative IMU learning curves for CODs in an emergency will be achieved faster. Thanks again for your remarks. And that's where I was first introduced to CODs in Haiti in 2010.
We have a question. The floor is yours.
Thank you, Manon, and thank you, Tom. I would like to know if the ITOS service is available.
Thank you for your question. And yes, the question was about the ITOS services. It means the well, there are APIs for some specific data collection, but I think the reference is to live geo services of COD ABs. And I will begin my response by again apologizing to the colleagues at ITOS, our partners in America, who provide the services, by not emphasizing them much in this presentation. The answer is absolutely yes. And in fact, in the last 6 months, the coverage or availability of ITOS live services has spread from being about 100 of the locations to all 164. On page 3 of the portal, there is information about accessing ITOS live services. So these allow you to plug the most recent COD available online into your geographic information system software. Thank you for the question. Thanks, everybody. Best wishes from Ottawa. Over.
Thank you for your time.